Welcome to the Java Cafe, Java fam.
Good day, everyone. My name is James Hills. I'm the host of Java with Jimmy, and we're here today. There are three guests that I'm getting to know and meet for the first time. No, I'm lying. As you all see, I have my baby sister here, Tamisha, and as she shared in comments, and I've shared before, she is a breast cancer survivor. As this is Breast Cancer Awareness Month, I thought it was important, in talking with Dr. Alabre, who's not on camera, and also Cindy Diggs, we really thought it was important to not just talk about the information, but really bring someone that's had some real life experience with surviving breast cancer. Before we started, I was saying, hey, Misha, you got to talk up a little bit. And she's just about 2 weeks out of a second surgery. And so we just asked that you be sensitive. If she goes a little low toned or whatever, her big brother will kind of nudge her. But I would like to present to some and introduce to others my baby sister. I'm hitting my mic. This episode of Your Healthy Java is definitely personal to me. And so my mother is in the room, though not on camera. So between the three of us and listening and whatnot, you may just really see a sincere appreciation. You may see some frustration because, as we talked about in our last episode with our guest, and we're going to introduce our other guest in a second, we talked about systemic structures that lead to people like my sister, who's a Black woman, sometimes not being endeared or treated with the utmost proactive approach to what the illness is. And so very quickly, we're going to talk more with them, but I would like to at least acknowledge two of my other guests that are with us today. One is not a stranger to Java with Jimmy. She was a part of the panel, and I'm still getting text and stuff about some of the comments from both panels, but definitely one about yours as well. And we have Dr. Beverly Moy, who's from the Cancer Center here at Massachusetts General Hospital. And then we also have Nakia, and remind me of your last name.
Clark.
Nakia Clark. You had the same name as my sister. The N-E and the N-A at the beginning is the only difference. And so it was just kind of like saying Nakia, and I was like, oh yeah, she has a last name. But Nakia Clark is here from the LE Fund, and we're going to hear more from both Dr. Moy and Nakia as well. So Misha, I don't even remember how I found out. You didn't come like directly and like tell me. It was something, either a post. I don't remember.
I think I sent you guys a text message
about something on the, you did. It was a group family text message that they saw something or whatever. Okay.
Because I had told Mom, and I was like, definitely with you, I wanted to make sure you heard it from me before you heard it from somebody else. So I was like, the easiest way is to message you, Nikki, and Cammy all at the same time and say, this is what it looks like. You know, I don't know what it is, but I have to go through further testing. And the way it started was because since 2016, I've been going back and forth with biopsies and probably gonna say it wrong, papillomas.
You've had papillomas.
Yeah.
Since
2016, they're benign. The first ones, there was some abnormalities, so they went in and they did a deep lumpectomy. And when I say deep, it's because they took out like half a cup size of tissue. So that's a lot of tissue being taken out. So they took that out, and then it was like, oh yeah, you're fine now, everything's good. So then we'll just monitor you. You have to get mammograms every 6 months, and then it's like, oh, we got a biopsy again. Oh, we got to do this. But the first ones, it was like, oh, remember, because I talked to you about it then, and he was like, oh, it's going to be nothing, it's going to be nothing.
Yep.
And it was like, oh, it's just milk ducts. Oh, it's cysts. Oh, it's, and then it was like, oh yeah, it's nothing. You're not going to, nothing to worry about. Then it was like, oh yeah, you got to have surgery. And I was like, oh, so it's kind of been like that throughout this whole.
So since
everything.
16?
Yes, since 2016.
I didn't know about it was going back all that far.
Yeah, because everything has been, oh, it's fine. Okay. So it's like,
you felt no need to kind of like,
yeah, they would be like, oh, you have a little mass. We don't like the way it looks.
Can I interrupt a little bit? What made you, did you do the home breast exam?
No.
What made you like even go to like look?
Discharge, nipple discharge.
Okay.
And in 2016, my youngest son was 5.
Yep.
So I'm no longer breastfeeding. So, I went to the doctors and I'm like, what's this? And they were like, oh, let's take a sample and let's give you a mammogram and let's do this. So I was like, okay. And then that's when they were, everything's going to be fine. We're going to do ultrasound. We're going to do this. And, oh yeah, it's fine. Then it was like, yeah, you don't have to worry about it. You're not going to have surgery. You're not going to. Then it was less than a week later. I was like, yeah, you got to come in. You got to have surgery next week. And I was like, okay, my job, I'm employed by the MBTA. So I had just had a few months earlier surgery on my wrist. So 4 days later, here I am driving a bus with stitches in my boob. Excuse me, guys, but that's what it was. So again, off and on over the couple of years, that's what I went through. And everything was, oh, it's benign. Don't worry about it. So skip ahead 2020, I have a lump. Again, in the same place, edge of my nipple, the edge, like really.
And at any point where you want to check with Dr. Moy, you want to chime in that.
And I'm like, it's kind of big. I feel it. And so I went, again, they removed it because I was like, yeah, I don't like it. I don't feel comfortable. So she was like, all right, we'll take it out. It looked benign, but, we'll just remove it anyway. So we could just, check the pathology on it, whatever. Came back, oh, it's benign. This is all, healthcare at Harvard. So we went. So when she did this doctor, she's no longer at my.
Don't get into names. Institution maybe. Okay.
I'm not giving a name. She's no longer at my, PCP. We'll do in-office removal. I'm like, okay, I don't know how this is going to work out, but okay.
Almost like a day surgery in the office?
In the office, yeah. So I'm like, okay, so then we're just doing it. And I'm like, oh, yeah, I got to cauterize it. So now I'm awake. And I'm telling her, I'm like, you got to use extra lidocaine because lidocaine doesn't work for me. So I'm like, yeah, I'm starting to be able to feel this. And I'm just not happy with this situation right now. And then I'm like smelling my flesh burning. And that was a whole disaster because then she only put 3 stitches in place. I'm in the ER like a week or 2 later. The incision is infected. I go to the ER. They contact her. She tells them, oh, what does it look like? No, I only put 3 stitches in. Don't treat her. Tell her to come see me tomorrow. And I go see her. All she does is wipe it with saline and put a Band-Aid on it. And I'm telling her, I'm flipping out because I'm like, I can see inside my boob. Like, what's going on? This is not okay. I'm losing my mind. I'm telling my kids if I die, because I'm literally seeing infection. I'm looking inside my boob. I'm like, this cannot be what this was supposed to be like. I'm like, I had this surgery before and it was not like this. Like, what is going on? So she's like, yeah, just put a Band-Aid on it. And I'm like, I don't get this. So I'm putting the Band-Aids on it, latex allergy, adhesive allergy.
You really take after Ma.
Yeah.
You're allergic to everything.
Right. I start getting the burns from the Band-Aids. I'm like, I can't deal with this. So finally, it took like 4 months for that to heal. Oh, you have to let it heal itself from the inside out. So I went through all of that. So I'm like, finally, it healed. I'm like, thank God I'm over the worst of it. Now, a few months, again, this was 2020. A few months later, shower, I'm like, feel a little bump again. I'm like, oh man, it can't be coming back. Like this can't be coming back again. But I'm like, nah, this is just a little pimple, watch it again. I'm like, nah, this got bigger. It came back big, fast. So I'm gonna call my doctor. Now I need to be seen.
Same doctor.
Same doctor. I need to be seen. We need to check this out. It's the exact same place, exact same thing. It's the exact same size, if not bigger than when you removed it before. I need you to come and check it out. And she's like, oh, well, we'll do a biopsy in it. Oh, Tanisha, it looks benign. We could just leave it there for a year, check it. I said, a year? I said, girl, you see how this grew in a couple of months? I do not feel comfortable with you telling me we're going to leave this here for a year. I want this removed. So she goes, okay, well, in the office, I said, you lost your mind. We will not be doing this in the office. You will take me to the hospital. You will put me to sleep and you will remove it the right way. And you will put stitches in it and close it from the inside and you will close it on the outside properly. I'm not having you do what you did to me the last time. She was like, oh, so you want to be put under? Absolutely. You want me to I said, I want it completely closed.
Mm-hmm.
She said, okay. So we went to Mount Auburn. So then I get the results, lab results.
Yep.
And I'm looking and I'm sitting and it goes something carcinoma. Mm-hmm. And I'm like, no, this is not real. Nope. Close my phone, put it away. I'm like, let me go back in. Let me look again. I think I read that wrong. So I'm looking and it's like,
you know what carcinoma is.
Right, ductal. I'm like,
ductal carcinoma was what the pathology said.
So I'm like, okay, and it's like, and block this and block this and block like. So I'm like, oh shoot. Okay. So when they removed it before and it came back with abnormal results, it was because we went into the hospital and the pathology at the hospital said it was abnormal. So every time we went to a different facility, came back with different results. So now I'm thinking in my head, how long has this been going on?
Mm-hmm.
So that's when the doctor calls me right after Thanksgiving last year. And she goes, yeah, Tanisha, yeah, I don't know if you got to see your results yet, but yeah, you need a mastectomy. I said, the devil is a liar. I'm not. She goes, what do you mean? I was like, no, I don't. She was like, yes, you do. I was like, I'm sorry. She was like, well, Tanisha, I'm telling you what it is. And yeah, so you need to come in and we need to talk about it. I said, talk about what? She was like, well, and she got an attitude. She's like, well, if you feel like you need a second opinion. I was like, absolutely. I definitely need a second opinion. She was like, all right, well, you can go ahead and get it and call me later. So I was like, bye. So that's when I ended up contacting Beth Israel and Dana Farber and who else? Another doctor at Beth Israel. So I ended up getting like 3 other opinions. And they all said I needed a mastectomy. So I was like, dang. But it wasn't until I seen the doctor at Dana Farber when she showed me my imaging and Mom was with me. So she showed me and she was like, so my doctor did say, she was like, you will need reconstruction anyway if we try and do another lumpectomy. Because I did in between then, after it came back that I had the DCIS, they did go in and try and...
DCIS, what is that?
Ductal carcinoma in situ,
Okay.
Which is a form of breast cancer, but is not invasive, but
Right.
you still have to remove it.
Right.
I've been sitting here struggling not to bring you in
the
to
exact-
ask
I'm
of these
sorry.
atypical. I said, no, you're good
Like,
because the thing that I think it's important to kind of let you go through sort of these steps is you're not the only one.
Right.
There's somebody listening right now that is dealing with some level of this.
Right.
And so we can stay here for a couple more minutes. To
Right.
speed
I'm
up
trying
today.
to squeeze it
No,
all
you're
in
good.
really quickly.
You're good.
So after the first diagnosis with the results, she was like, come in. And that was before I got the call on Thanksgiving. So they did they tried to do another clean out. And again, they took out more than half a cup size that time. So she was like, if we go and take out more, you're going to end up deformed. No, she didn't say that. She was like, you're going to end up needing reconstruction anyway. So I was like, okay, whatever. That's when she called me back and was like, you need a mastectomy. And then that's when I met with the doctor in the end of December at Dana Farber. And she was like, look, this is your images. And she was like, we'll have to cut off this whole half of your boob. She was like, you're going to need reconstructive surgery. Anyway, so she was like, listen, I know you're young. I don't know why this happened to you. She was like, but you need a mastectomy. So we're going to schedule your mastectomy for February. She was like, and she was like, we're going to do it for 3 weeks.
This is when you started telling me.
Yeah, she was like, we're going to do it for 3 weeks from now. She was like, matter of fact, I want you to have this doctor. So no, we're going to push it off till February, because I'm sitting there like, what? So I'm like, I guess, because all these other doctors are saying it, I guess I have to accept it. And that's when I went from trying to finally putting it in my head and accepting the fact, like, okay, I'm going to get the mastectomy. Sure, fine. She was like, you could do immediate reconstruction, the plastic surgeon, whatever. So then I went through the Zoom meeting with the plastic surgeon's assistant. And she was like, yeah, well, even if we can't do it immediately, because the doctor said you need to bring your BMI down and they want you to lose between 25 and 40 pounds. I was like, okay, cool. I already started dieting. As soon as they told me that, I started dieting. She was like, okay, great. She was like, at the tops, maybe you'll have to go 3 months without a boob. And I'm like, 3 months? Like, that's a lot.
Yeah.
Like, I don't know if I could do it, but I was like, 3 months isn't bad. And I was like, I'll do the 3 months. Okay, cool. So then I talked to my doctor. We're getting closer and closer to my surgery date.
This is the same primary doctor out of Harvard?
Nope.
This is a Dana-Farber.
Yes.
Okay.
Out of Dana-Farber. But she called me and she was like, yeah, Tamisha, we want to schedule your surgery time. And she's like, how's your weight? Because she was like, well, you're not going to lose the weight. I was like, you don't know what I'm going to do. I said, well, how about instead of you telling me what I'm not going to do, you pull me in for a weight check before, like a week before the surgery to check progress.
Yep.
And she was like, okay, fine. So your surgery is scheduled for the 22nd. How about we schedule you for the 15th to check your weight? I was like, okay, cool. So I'm like, I bought one of those scales that measure your BMI and all that. I was like, I can tell you right now, everything's coming down like it's supposed to. So we go through all that. Then she called me back a couple of days later and she's like, yeah, well, Tamisha, plastic surgery said they're not going to see you. And I'm like, what do you mean they're not going to see me? She was like, yeah, they said they're not going to see you. I'm like, why not? She was like, well, you have a history of high blood pressure and you're borderline diabetic or whatever. And, maybe, your numbers came down, but still, they don't think you lost enough weight. I'm like, you don't know. You haven't. I haven't been coming for a weight check. How would you know? She's like, yeah, they're just not going to see you at all.
So without the second weight check?
Yes.
Okay.
Without seeing me in person at all.
Okay.
She was like, yeah, they're refusing to meet you in person at all. I was like, what do you mean? So I got off the phone with her and I, like my chart online and all that. So I went in and I wrote her a very long, very detailed message. I was like, let me just tell you, the care that I've got from you guys is disgusting. I said, it's bad enough you tell a woman that she has breast cancer. I said, then you tell this woman she has to lose one of the things that essentially make her a woman. And then you're telling her you want her, because she was like, oh, well, you can get a boob in a year, if ever. What do you mean, if ever? So I was like, you like, unless a person would kill themselves over something like this, like, how do you just try to destroy someone instead of being there and trying to help them, counsel them, and work with them through this? You guys are just, no, we're not. I was like, you can't do that to somebody. So then after she reads the message, she calls me, Tamisha, you're going to hurt yourself? I said, no, I have too much to live for. I would never hurt myself.
That's
I said, but the way you treat people is disgusting. You can't treat someone like that.
Mm-hmm.
How are you treating a person like that? So then she goes, you know what? This is what I want you to do. I want you to contact this doctor at Beth Israel, who is equivalent of me. And I want you to contact this doctor. So she told me to get in contact with the chief of breast surgery and the chief of plastic surgery at Beth Israel. And mind you, this was like February 2nd or 3rd. I got appointments with them for February 9th. Again, mind you, my mastectomy was scheduled for February 22nd. I met with them and they were like, okay, cool. One of them, I did meet the head of plastic surgeries. I did a Zoom with him because he was sick. He was like, COVID out, he was like, yeah, everything was, sure, why not? He was like, go meet with breast services and I'll confer with them after you meet with them and we'll see what it is. I went and met with them and they was like, yeah. And I'm sitting there, I'm like, yeah, so, I'm down like 25 pounds already. They said 25 to 40. He was like, oh, that's good. You lose the weight. What do you lose the weight for? Well, it was like dieting is always a good thing, but why are you telling me about it? And I was like, well, because they said I had to lose weight. He said, who said? And I was like, well, they told me my BMI was too high. I was too heavy. He said, Tamisha, we do this surgery, because I wanted immediate reconstruction with the deep flap, which is when they take your stomach tissues, your fat and everything, and vein and artery, and they make you a boob out of it. And he was like,
it's just so interesting hearing my sister here talk about boobs and stuff.
So he was like, we do this surgery every day. And he was like, I'm going to tell you now, we've done it on women way, way bigger than you. He was like, with BMIs way higher than yours. And he was like, and if your BMI was too big, too heavy, he was like, we have these sponge things that we would just put on your incisions to help your wound drain before we send you home, before we were comfortable with sending you home. He was like, you don't have to worry about that. There's no reason why we cannot do this surgery for you. We'll run your tests. We'll go send you for your imaging and make sure everything's okay. If everything's okay, you're all set to go. And I had all my surgeries on March 31st.
And a recent reconstruction within the past few weeks.
The nipple grafting.
Okay.
And revisions to my stomach.
What is it called? Revision?
Revisions to my stomach, because I had what they call dog ears, which is
Is that like left hand? Is it the medical term?
I call them front handles because they were not really on the side. They was more kind of
okay.
I just had that done, but yeah.
One, I want to, you're my sister, but you're also a guest, and so I want to thank you for being transparent. There's a couple of things that you said that I'm like, well, why didn't she tell me? But
but it took me a long time to wrap my head around it.
Understood.
And to go through it and
understood
to deal with it.
Yep.
So I tell everybody
no
that.
apology needed. I think that's just the big brother. I also want to say that we have medical providers here, but no one, from psychiatry or whatever. Now, are you, as a part of your surgery, are you in therapy? Are you?
Not yet. I keep saying I'm going to do it, but
it's on you that you don't go. We'll talk about that later, big brother and sister. So I want to, again, thank you for sharing your story. I want to also say that we know that my sister is not the only one. I'm getting ready to bring in our Dr. Moy and also Nakia. And it's so funny that I'm talking to you when I'm saying Nakia, and it's just great. It's very weird for me after hearing this. And so I'm proud of you, because I heard advocacy in you with your little Cindy Diggs from here at MGH. We joke about the fact that when I get upset, I'll write a little letter. And so to hear that, so I want to get ready to bring in our other guests, Dr. Moy and Nakia as well. And so Dr. Moy, just in chatting with you at the health fair a couple of weeks ago, presumably, I know that some of what you heard does not surprise you. I would presume that some sort of, and it's for lack of better words right now, first I'll say it's not infuriates, frustrates you in hearing. And so Dr. Moy, in hearing Tamisha's story, what is your response as a woman of color, a doctor, someone that's very familiar with the population that, MGH is serving and wants to do more with certain population? What's your response?
Well, I think that your story is incredibly frustrating, but not unique, which is really sad. There are a lot of women who feel something or know something is wrong, and they go to and men, frankly, of color, and they go to their physicians or healthcare providers and potentially say, I have a feeling something's wrong. And the data, the evidence does show that there is something called implicit bias.
Yep. Meaning
that, doctors, not intentionally, but implicitly may think, may not be as eager to offer evaluations or treatments to people of color. And it's important for us to own that and to remedy that.
Yes.
And because it is certainly a part of the disparities that we see. And, I'm a breast cancer oncologist. We have done so much better in the last decade in improving survival after a woman's diagnosed with breast cancer. But the thing that is persistent is that Black women with breast cancer continue to be 40% more likely to die of breast cancer compared to white women. So survival's improving in both races, but that gap is still there. Like, why? Why is there this gap? And there are a lot of reasons. One is lack of access. That's probably the most important reason. I hear your story, and there's so much there, but you started this in Thanksgiving, and you didn't get your treatment till the end of March? What? Like, that is a crazy delay, in my opinion. You got differing opinions from people who are specialists, which is very hard because you're trusting people to tell you what's best. You've never been through this before. You ended up getting excellent care. And I think that there were a few things that some of the doctors did that were really good. Even like the one at the Dana-Farber showed you the pictures. You know, you were like grappling with people telling you need a mastectomy. Showing you the pictures that made you understand, oh yeah, I really do need that, which is something that I think is important in terms of communication. But you also said things that were very concerning, like you're like, it's growing, something's wrong. You had to talk about the type of surgery you wanted. You were told that you needed to lose weight, and they just kind of said, oh, you're not going to do it.
Right.
So you never tell a woman she's got to do something. Right. That is like, no. But yeah, I think, in the end, you got really great care, but I feel very sorry that it took you months to get there. It shouldn't be like that.
Right.
Dr. Moy, one of the things we're going to bring Nakia into this conversation. One of the things that, of course, there's the medical piece and taking care of it, but there's also sort of the psychological, there's the financial implications, there's medicine. My sister's name is Tamisha, but I call her Misha. Misha, that you were in contact with these doctors directly. You're advocating for yourself without a nurse case manager and whatnot, which again, proud of you, and you learned a lot, and somewhere you need to talk to Nakia, Dr. Moy, because you might have a new career. MBTA might need to let you go.
We spoke briefly at the health
at the health fair.
The health fair.
Okay.
Yeah.
And so Nakia, I want to bring you in around what is, first of all, I don't know if you have a little bit of, I believe you do have a story, and maybe, I see all type of mentoring and whatnot, but tell us a little minimally about the Ellie Fund at first, a little bit of your story, and then we'll go back more into the Ellie Fund, because I think we need to hear a little bit of your story of why you're now in this space and do the work you do. So please tell us about that.
So I'm listening to you and I'm nodding my head because I went through some of the same things that you did.
Right.
When you felt a lump years ago. So I felt something in 2009 that just didn't seem right. And I went to my doctor and I got a mammogram and they're like, oh, it's fine. But it was just something in the back of my head. And I went to see another specialist and they're like telling me to take vitamin E. And that, I was going through prompted my mom to say, you know what, I haven't had my mammogram. And she got a mammogram and she was diagnosed with breast cancer. And that was due to me going through my journey and that prompted her. So when I went back to my doctor to say, you know what, my mom was just diagnosed. They did do a biopsy just like you and removed it, and it was benign at the time. But then 2018, that same area where the scar is, I felt another lump. And again, the oozing. And I was like, my son was 4. And I'm like, I've stopped breastfeeding. Why is this happening? And it ended up being a DCIS, same diagnosis as you. And I had a mammogram 4 months prior, and they didn't pick it up. And even when I had my second mammogram, it didn't pick it up. It was a ultrasound that picked up the DCIS. So we have the similar things where you felt something was wrong and you advocate. And I commend you for that, because I had to do that for myself, is advocate. So I was diagnosed, and at the time my son was still in daycare, and I was wondering, am I going to keep him in daycare and try to struggle to pay, or take him out and try to recover with him home? And I knew of the Ellie Fund because my mom had utilized their services, and I didn't maybe I didn't look the part, but no one came to me to say, hey, we could provide some services to you.
Yep.
I had to tell the doctors, I know that there is this organization and I want to seek help. And that's how I was hooked up with the Ellie Fund, and they helped pay for the childcare. And I was just so grateful for that once I healed, I started volunteering for them. And through that, I met the executive director, Meredith Mendelson. And
Hi, Meredith.
Right.
we
So
formed
awesome.
a bond. Yes, we formed it. She would check on me frequently. And last year, she mentioned to me that there's a job there for me. And I became the director of patient services and outreach. And my job is to go out there and talk about the Ellie Fund and tell what their services are. And most certainly to the women of color who I can relate to their experience just like you. Right. And they see someone that looks like them and they're more willing to go out and get the help that we provide. And so I'll tell more about the Ellie Fund. It's 27 years that it's been in existence, and it started by two brothers who lost their mom to metastatic breast cancer. And she used to do a lot of reading to children and doing a lot of nonprofit things. And so it morphed into what it is now, where we provide services to men and women going through a breast cancer treatment.
Can you say that again? Men and women?
Yes.
We're going to talk about that in a second.
Men and women. And we do serve men, not many, but we do serve men, and because they do get breast cancer, as Dr. Moy can speak to that. And the services that we provide are childcare, just like for me, 50% of childcare reimbursement, grocery, which is one of our biggest things that the patients, because of the need for food, it doesn't matter which grocery store, we will provide whatever they need for them and their household. So it's not just the patient. We think about the whole family, the whole household. And that includes adult children who are living in the house or adult parents that they may be taking care of. We include everyone who's in the household because, as you know, women take care of their families. And so we provide grocery assistance. We provide transportation in the form of gas gift cards or Uber or Lyft to go to and from their appointments. So there's no barriers, as Dr. Moore has always said, to getting to the treatment. Some people will not go to treatment if there's these barriers in the way. So the Ellie Fund is there to provide some of those services. Housekeeping, we provide that. Integrative therapies, so it would be in the form of oncology massage or for acupuncture. And our grants last for 3 months if you're curative, which is a stage 0 to 3, or 6 months if you are metastatic stage 4.
In active treatment. So one of the requirements of the Ellie Fund, you do have to be in active treatment, in which you are. There's so much, and I don't know how much time we got left. I'm gonna look to the team. 3 minutes? Oh, 30 minutes. Okay, I was going to say, wow. Okay. And so it's just, Dr. Moy, it's so interesting. First thing, let's just establish, not that it's minuscule, but let's just name that men can get breast cancer. Are you able, 30 seconds, 2 minutes, can you give just a quick general of what, I'm hearing there's different types. Let's specifically, how do men get breast cancer?
Right. So breast cancer first is the most common cancer in women. So 1 in 8 women will get breast cancer in their lifetime. So it is very, very common. Men are far less likely to get breast cancer, but men have breast tissue also.
Yes.
So it's far less than 1% of all breast cancer cases that affect men, but certain men have higher risks for developing breast cancer. Those with genetic mutations that they inherited from one of their parents, like the BRCA gene mutation.
You're shaking your head. You've really learned a lot. Yeah. I'm so proud of my sister. Go ahead. I'm sorry.
Yeah. So that's a gene mutation that actually Angelina Jolie, the actress, has really been very public about having, that she inherited from her mother. But men can inherit that gene too, and that puts them at a higher risk for breast cancer. Men who have something called gynecomastia, where they have man boobs, I guess.
Yes. Yep.
So there are certain risk factors. But the important thing is that, if men also feel a strange, firm lump that's atypical, they should be seeing their doctors too. And we do see men, and it's great that the Ellie Fund helps them. We don't have as much evidence about treatment, so we treat men with the same types of treatment we treat women, actually. But they can have a very good prognosis if found early, like you guys found yours early, which is great.
It is just so, I'm encouraged, and we're going to be encouraged and show some self-care with you before we end today. But it is, when we had the panel, Dr. Moy, we talked about systems and structures. Mm-hmm. And you are a woman of color, but you were very specific in talking about the gap in Black women. Mm-hmm. And so not just with diagnosis of breast cancer and different things like that, but let's just talk a little bit about, I love how you said that the education needs to, or we need to know something in the fact of hearing about this experience. Any provider that's listening right now, what is it that you would share with them that would make them maybe second guess or think how they're approaching specifically? Let's just name, my sister is a voluptuous, curvy sister, and I heard undertones in there. She's a Black woman. She's not going to lose the weight. We're not going to see her. And so if there are providers that just because you're on, just maybe listening, what is it that you would say to them about approaching, let's go specific, Black women in dealing with things that they may be in the midst of 0 to 1. They caught my sister in what did they say they caught you in?
They call it like stage 0.
Yeah.
When you said that to us, because that's the first time I actually kind of heard that. But there may be some folks listening that if properly treated, they can get caught at stage 0 and it not progress to stage 3 and 4. And so what is it that you would say to providers? How do they not participate in the implicit bias? I'm sorry.
Well, I mean, I think, providers, doctors, nurses, nurse practitioners,
physician assistants,
everyone who provides, clinicians, have to recognize a few things at baseline. That most Black men and women have had negative experiences with healthcare. And that is also true of other races as well, but certainly more disproportionately with Black patients. Mm-hmm. So it's important for us to work harder to establish that trust and to listen, to maybe acknowledge that, but to really, I think, prove that we care and we want to provide good care. And that may take more time. It may take some patience. It might take some humor, but you got to get there. Because if, the last thing you want to do is going to call someone and say, you need this, like the stories you're telling, because it's not going to be taken well. And I think that any person is going to be more likely to accept a recommendation from somebody who's really listening. But it does take time. And that's why it can be hard with cancer, because time is of the essence. Mm-hmm. And that is one of the reasons why some patients don't do as well as far as outcomes, because you don't want to delay treatments unnecessarily. But you also, it's our responsibility to get people to a place where they're willing to accept treatment. So it can be a pretty dicey, interaction, but it's our job to do a better job that way.
I agree. And I when Nakia jump in here at any time, Anisha too, we can just sort of have a convo now. I was surprised to hear your reaction or see your reaction of the date time of like the end of December until March. That seemed to you like that one shouldn't have happened. And it should be atypical, but as you said, it's not uncommon to hear just about the impact of systems.
Right. I mean, as one of my jobs, I look at what we call the indicators of quality of breast cancer care, right? And unnecessary delays often lead to worse outcomes. In your case, thank goodness with stage 0, you didn't have an aggressive type of invasive breast cancer, but a 4-month delay to surgery would be unacceptable if that were the case.
I mean, I went through so much of it because they were like, oh, you have to do radiation. And I'm like, okay, cool.
And the first thing you thought?
No,
I'm messing.
No, because it was going to be on the breast. So it wouldn't have affected my hair. So I didn't know that. And I met with the radiologist the
Radiation
radiation oncologist. Thank you. And he told me everything. And he's another one. He was like, I looked at your whole chart and you need to have a mastectomy. And I was like, okay, all right, cool. But he was like, let me tell you what we can do. We can hit you with this many appointments. You'll do this. And he was like, but the radiation can hit your heart and it can weaken it and you could have a heart attack or this. He was like, it can hit your ribs and weaken your ribs. It can do this. And I was like, this is not sounding like a good option for me right now. Like, I feel like the mastectomy might be the better choice. And, you know, then they were like, oh, you're going to have to take the tamoxifen
Yes.
for 5 years. And I was like, okay, cool. Went to the appointment and was like, let's go. First of all, they had us wait for like an hour. So now I'm on 10.
If you're anything like your brother.
I'm on 10. I'm like, where y'all at? Let's go. I gotta go. I got another appointment. I got things to do. And he's like, no, sit down. I was like, sit down what? I've been sitting down for almost an hour. I'm leaving. You want to talk to me? Make another appointment. Send me a prescription. Whatever you got to do. But I'm not saying. And then he's like, the other doctor came in. He was like, yeah, no. I looked over her chart. There's no need for her to take the medication. She's no longer a candidate for the medication. So tell her, have a nice day.
So can you give a little bit of clarity? Did I see your face?
Well, so I mean, you could have they could have done a much better job explaining these things. First of all, the wait, unfortunately, really common. But I also think it's important. I always tell my docs, if you're late, apologize immediately upon walking in the room, acknowledge to respect their time.
And let's just name that while I understand you. I don't like to wait either. But let's just name as patients.
Right.
If you come in and tell me you can't go into details, but we got to balance between wanting our doctors to take the time.
Yeah.
And then be sensitive to the fact that they're 5 minutes late.
Yeah.
But that's also a system structure because I used to do scheduling. And there are certain quotas that the hospitals want our providers to meet in order to bill. Let's just keep that 100.
And also there's so many patients that need care.
Yep.
And you only have so many times in a day, so much time in a
That's
day.
right.
So you want everyone to get the care. But, you have to acknowledge, but I think that a few things, the radiation oncologist, for folks out there, radiation can be very safe to give. It has to be explained. If it's appropriate, don't shy away from radiation.
Yeah,
right.
That's important.
Right.
But I think that certainly when they say, you're no longer a candidate, first of all, they should be talking to you, not to each other, and explain why. And I imagine they said you were no longer a candidate because you were going to get a mastectomy. So then
this was post mastectomy.
Yes.
So this was after.
Right. So you didn't need the tamoxifen. Exactly. Which is good.
Yeah.
But it should have, it could have been explained in a nicer way for you to understand. Good news, actually.
Yeah. I think it was because I had already yelled at the other doctor and was like, I'm leaving. I was like, I'm no longer sitting here. It's been an hour and I have 10 minutes to get to my next appointment all the way up the street. So, because it's like, I understand, again, with schedules and doctors and patients needing care, I'm not an urgent case. You just want to talk to me about a prescription. Reschedule. You know what I'm saying? It was already like 2 months after my surgery or whatever. So it's not urgent. Tell me, hey, I'll call you, or what pharmacy do you want me to send it to? Or can we talk about this later? Don't leave me sitting in a room for an hour and then.
You were in the room, not in the waiting room.
In a room.
That's a little bit different, right? Because the waiting room, you can expect an hour, but if someone leaves you.
No, we were in the room. And that's why I was like, I'm out of here. I gotta go. I try to be nice. Hey, I'll be there in a minute. And I see him sitting in his office, walking around. So what it was, he said he was waiting for the other doctor because he was a fellow and all this other. So I get that, dude. I gotta go.
His attending, and we understand those. They gotta check in.
I get all of that, but then the attendant was like, "Why is she still here? She's not taking medicine." Like I've been like, "No," and I'm like.
Let's just also name and be sensitive to, we've named some institutions. We are here at the wonderful Massachusetts General Hospital, which is really from the panel in the sickle cell focus to people like Dr. Moy, Dr. Labre, Dr. Betancourt that are here. But again, I got to go back to the correlation of the clinicians addressing the medical piece, but just to hear that there is a fund in place that can help people because there is a psychological impact from both of you as survivors. Like, how much of a relief was it for you to to get the gift cards, to know that somebody would help with, offsetting childcare costs, because there is, can you talk about it? And then maybe we can get ready to wrap up with a little bit. There is a correlation between if you're dealing something mentally and stressed, it does not help the healing process.
Wait, before.
Yes, go ahead.
Real quick, because she went through the same thing I went through, but I had someone tell me, Tamisha, stop it. This was close to me. Oh, Tamisha, stop it. There's people out here with real cancer.
Yes.
That's my mother, y'all hear in the background talking about.
And I was like, wait, what do you mean real cancer? Like, because this is real cancer. Like, I have to have my boob cut off. What's fake cancer? Like,
Yes.
so.
The type of cancer that we were diagnosed with, some people say it's not cancer at all. But it is.
Can I just ask some questions? Is it cancer, Dr. Moy?
So it is a breast cancer.
Yeah.
It's the kind that will not threaten your life.
Okay.
Which is great,
Mhm.
right?
If treated and
If
cared for
treated,
properly.
exactly.
Okay.
Right. And so you do have to remove it surgically and make sure you get it all out.
Okay.
Right.
So if this DCIS is affecting, most of your breast, unfortunately, you have to remove the whole breast. So
Right.
it is breast cancer. I spend most of my time though dealing with your mom's situation,
Mhm.
right?
Mhm.
Who had, she had spread to other parts and, it's more invasive but it is all, it doesn't matter if you've had to undergo all of these types of treatments. And being told that you have breast cancer, no matter what, it's traumatic,
Mhm.
So what the Ellie Fund does, I'm so happy to partner with you guys because you help make patients whole again.
Yes.
You make it easier for them to get the quality care that they need because there's so many stresses. I mean, you said it earlier, women take care of the families, they take care of everyone,
Mhm.
but they need to take care of themselves
Right.
during this
Right.
time.
Right.
And you make it easier, the Ellie Fund makes it easier to do that.
Yes.
And
Yes.
you mentioned from gift cards and just support and whatnot. What is Misha in your case uncommon, or do you hear about them a lot when you're servicing?
I hear about it all the time. So I make it a point because, like I said, I was serviced through the Ellie Fund. So I have that experience. So I make it a point to talk to the patients. And talking to the patients, I hear them like crying to me saying they're so relieved that we were able to help them because they didn't know where they would turn. Again, like me, I was contemplating, I'm just going to have to take my son out of daycare. A 3-year-old rambunctious boy running around when I had a double mastectomy with the reconstruction where for the first month I couldn't even walk up straight because of the pain.
Yep.
So I was just so relieved. When I got that letter saying what I would be receiving, I was so relieved.
Let's pause for a minute. I'm going to ask the team to just do me a favor. Let's just do this now. Can you look behind there and pass the items that are back there to us, please? Pass them to Nakia. So you met Meredith, you met Nakia. When I tell you that Dr. Moy and both Meredith were not very happy in hearing about your situation, Meredith was very adamant along with Nakia. And I'm going to try to do this and just be okay. Nakia and Meredith want to make a presentation to you. And we can't stand because of stuff, but I'm sure Dr. Moy won't mind. You can give the card or Dr. Moy pass the files. I'm sure she won't mind. But however you want to.
Yes. So we were so upset that we didn't get to you.
Y'all going to hear from Meredith in about a week or so. She's coming on solo.
We were just upset. Like we should have been there at the beginning, but you're still in treatment. And we talked about it, me and Meredith, like we have to do something. So what we decided was we wanted to give you a gift card for food for you and your family.
Thank you.
So that you can buy groceries and don't have to worry about, you can use that money for something else. And I wanted to throw in some flowers. It's breast cancer awareness and something that could cheer you up as well. So this is a part of us in the Ellie Fund. We want to present that to you.
And they're going to hug it out and stuff when we get off the camera.
Right.
I just think it was so important. She's my sister. Y'all know how I am. So, but I think it was very important to, one, because of the subject, two, because of, what's Mom over there doing? Two, because of there's somebody that's listening to you today that is like, oh shoot, and it maybe hopefully has empowered them or shown them that they have the power. Because when we empower, we can also disempower. Show them that they have the power to do their own advocacy. And if it's not, there are folks, if you were in active treatment, you can reach out to the Ellie Fund. How do folks contact the Ellie Fund?
I'm glad that you mentioned Empower, because one of the things that we launched this month was the self-referral application.
Oh, wow.
So you can advocate for yourself and go on our website and submit an application. You don't have to rely on a doctor or a nurse.
Okay.
Any clinician, you can do it all on your own.
And where is that website?
It's elliefund.org.
Spell it for us.
ELLIEFUND.org. O-R-G. Mm-hmm.
And Dr. Moy, one of the number one questions we get in your Healthy Java Cafe is when we have wonderful clinicians. First thing they want to do, they want to come directly to the guest. And I know you probably may not have presumably may not have the availability to take on new patients, but how does someone reach out to the MGH Cancer Center to, even if they're not in the MGB system or whatever, how can someone at least inquire? Because if your colleagues and whatnot are anything like you, Dr. Labre, Dr. Betancourt, and Cindy and others, this is definitely a good place to seek some care. So how can folks reach out to the MGH Cancer Center?
So that's very kind, thank you. And I am taking new patients.
Oh, you are?
So,
okay.
yes.
But don't say that to me. I mean, unfortunately, we would hate that you have a big caseload in this discipline, but how do folks get in touch with you at the Cancer Center?
I think, we are very lucky to work in a cancer center full of amazing clinicians.
Shout out to nurse practitioner Leah.
Exactly.
And others.
Leah Gordon. So our entire team is great. So no matter who you end up with, it's going to be great. But folks can always call the cancer center, 617-724-4000, and then you hit the prompt for new patients and you will get a human being. And certainly we have our website, Mass General. Oh God.
We'll figure it out somewhere and put it out there, but
that's another way you can get in as well. But yeah, we don't, it really is important that if somebody has been diagnosed with cancer, we want to see people right away. We aim for within a week, next day is even possible often, so that we get folks in and get you going on your treatment.
So it is, I did well. I didn't shed one tear.
Right.
And so I just really want to thank, first of all, my guest, Dr. Moy is not she's going to be a veteran soon. But I want to thank you, Nakia, for coming. I want to thank you for the generosity. Also, Meredith will be with us, I think in about a week or so. And I also want to thank you, Dr. Moy, for not just your knowledge base in medicine, but there's a candor that you have that is very real. And I think it really like the Chan School and whatnot, when they're giving these instructorships and professorships, they need to figure out how to have you come and talk about patient care with some of these trainees, because it really needs a real perspective of someone that's been in the system, but also has, and I won't get you in no trouble, but challenges it to be more engaging in saving the lives of their patients. And so I really appreciate both of you in the roles. Not only you played with my sister, but just in helping people that are dealing with this.
Well, I think we also want to thank you, the both of you, for bringing
sharing your stories.
Exactly, and for providing a forum where more people can hear this message, because I think that's really the key for people to keep amplifying this message.
Mm-hmm.
Absolutely. Misha, thank you. There was not jokes, but she was on social media. I'm nervous. I don't know. I was like, just picture you and I talking on the phone, and I'm busy telling her about being low toned. And when you was talking, I almost want to say, hey, baby, take it down. Take it down. But no, in all seriousness, I want to thank Dr. Alabre, who was not on camera with us today, but did the logistics to make this happen. I want to thank Dr. Betancourt and Cindy. We are we're going to look at how we build this out more. So over the next few weeks or so, you may or may not see some repeat episodes. I haven't really decided. I personally don't want to. I want to keep us going with the lives and whatnot, but we're figuring it out because we want to make sure that we get as much information out as possible to as many people. And so just over the next month or two, things may look a little different with your Healthy Java, but we'll still be here on the first and third Tuesdays, either live or rebroadcasting. A couple of people are asking about the panels. You're going to show the panels again? I'm like, first of all, they don't have to be live. You can go to YouTube and Facebook and watch them. But thank you all for tuning in today. And we weren't able to ask as many questions, but you know how to reach us. info@javawithjimmy.com. Is that the email address? info@javawithjimmy.com to reach out if you have any questions, and we'll make sure we post the information for the Ellie Fund as well as Dr. Moy. Thank you all very much, and we will see you on the first Tuesday in November. Have a great day, everybody. Thank you.